Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa and today we're going to be talking about TheraHoney. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So the TheraHoney Sheet is a dressing that's impregnated with sterile, certified medical grade Manuka honey. It does provide an autolytic debridement and maintains a moist wound environment and also reduces wound odors. It requires a secondary cover dressing and the sheet is fenestrated to allow exudate to move through it. So indications for use. So we can actually use this on all types of wounds with all levels of exudate that require autolytic debridement and or a moist wound environment. We can also use this for wounds that have signs and symptoms of a local wound infection, as the honey is an antimicrobial. It helps with wound odors. It can be used in all age groups and for those who are pregnant and lactating. Precautions. So we want to consider monitoring blood levels in diabetic clients because we are putting honey on. So sometimes it can affect as it is absorbing. We're not going to be using this for more than 30 days, and it might cause a stinging reaction in some patients. So we would discontinue use if if the discomfort persists. Contraindications, we're not going to be using this in third-degree burns, and if a patient has an allergy to honey or bee venom, we will stay away from the honey products. So before we use this honey sheet, we want to warm it in between our hands. So you'll just take the package and kind of warm it up in between your hands before use. And make sure that you have cleansed and irrigated the wound with some normal saline and you have dried the peri-wound tissue. If you need a skin barrier, you can apply a skin barrier. Now to apply the actual sheet, for depths less than 1 centimeter, you're going to cut the sheet to size that fits inside the wound bed. Okay, you don't really want it overlapping onto the peri-wound skin. You want it in the wound bed, and you're just going to apply it directly to the wound bed. Now, for wounds with a depth of greater than 1 centimeter, you can use it as a wound filler, or it can be used in combination with other wound fillers. So now I'll go over how to actually use this with a wound filler. So you're going to cut the sheet into the size of the wound bed. You're going to place the patch in the, after you've removed the protective liners, you place it into the wound bed. Then you would apply your wound filler and the appropriate amount. Remember, just fluff it, don't stuff it. If you're using the sheet as a wound filler, you're going to remove the protective liners and fluff the sheet into the wound. Now, if you have sinus tracts or tunnels, you're going to cut the sheet into a spiral, okay? So you have to make sure that it's at least 1 centimeter, so when you're pulling it out, it's not breaking and we're not losing pieces, okay? So you want to cut it into a spiral, making sure it's at least 1 centimeter thick, and then you can just pack the spirals into there, and then you're just going to like fluff it into the wound. Make sure you always leave a tail so it can easily be seen and removed. So to remove, you're just going to gently remove the secondary cover dressing and then you lift out the TheraHoney sheet from the wound. The sheet might be white in color when on removal. Now the frequency of dressing change is just going to depend. It can stay in place for up to 7 days, but it once again depends on the amount of exudate. So change the dressing when the exudate reaches the secondary cover dressing and is saturating that. The expected outcome is that the wound bed is free of necrotic tissue within 3 weeks. Any signs and symptoms of infection are resolved within 2 weeks. And that the dressing provides a moist wound environment and the wound is progressing towards close. We just really want it to perform as expected. So that's all that I have for this video. I hope you did find it helpful for your practice, and I will catch you in my next video, guys. See ya.